some great pearls. And you had mentioned that you would not leave the patient in intermaxillary fixation. Would you take out the appliances at the end of the case, or would you leave them on for elastic use?
I typically take the appliances off. I find arch bars to be quite cumbersome for patients for oral hygiene, and also for gingival health. And if I'm not going to be utilizing them for any type of post-surgical management or stability, I remove the arch bars.
Got it. And then what's your general post-op protocol for Lefort fractures in terms of diet and activities?
Yeah, I think that, I typically close close the incision with dissolving sutures with monofilament dissolving sutures, and I keep them on a pretty strict regimen of oral care. I do have them brush their teeth right away. I have them using Paradex oral rinse 3 times a day. I do not use postoperative oral antibiotics, though. And from a diet standpoint, I'm trying to get that incision to heal. So for the first week, I do have them on a full liquid diet, and then I transition them to a soft mechanical diet for 3 weeks. And then after that, I let them, if their occlusion is stable and there's no mobility of the maxilla manually on follow-up, I do let them advance to a diet that involves more chewing. But then full diet restrictions are released at 6 weeks.
Got it. Okay. And so here's the patient kind of post-injury, and then it looks like it's 6 weeks post-operatively. He says his occlusion feels like it did pre-injury. Very happy. Let's say that the patient came back to you not in this setting, but in a different setting, 8 weeks out, and says their bite feels off. How would you evaluate that and treat it?
Yeah, I think part of it is figuring out, where the bite feels off. Sometimes I find that it's due to an undiagnosed or undetected dental injury that the bite feels off. So I think getting, again, a good history from the patient and understanding where exactly the problem is. And then I typically will get a Panorex or some type of just X-ray, not a CT scan post-injury. Post-repair to after the initial repair to look at the baseline. And I think that if my clinical exam at 8 weeks post-op indicates that there is a malocclusion, I would at this point get a CT scan. I generally will get an ICAT in our orthodontic office because I like to look at the dental roots, and I feel like the orthodontic imaging gives me a better understanding of that anatomy as well. So that would be my next step in assessment after history and clinical eval at 8 weeks.
Okay. And let's say that the maxilla on your exam was mobile, and there was tenderness over the fracture site, and you saw some loose hardware over on the CAT scan. How would you manage that at 8 weeks post injury?
So I think that what you're describing is a non-union or a malunion. There might be a fibrous union in a certain aspect, and a non-union in other aspects, especially where the hardware is loose. And this warrants surgical intervention. I think at this point I would look at treating this as a orthognathic procedure on one level, because we want to get the occlusion correct, and getting dental models, doing an intraoral scan to get dental models, and then determining what surgical movement is needed at the Lefort 1 level. Now, we wouldn't make a new osteotomy, but I would need to go back in and take out the old hardware. I would probably do virtual surgical planning to design custom hardware, given that the old hardware has created areas of weakness where the screw holes are, and needing to determine where we could put new hardware in to stabilize the maxilla. The other option, if he didn't have the seizure disorder, would be to potentially consider IMF. I think that in this patient that is not advisable. And it's also more of an undertaking for a patient 8 weeks post-trauma to then be in IMF for 6 weeks.
Well, thanks for your insights and some excellent technical pearls, Dr. Singh. And for the audience, if you enjoyed this case discussion, we hope that you'll join us for one of the AO CMF Management of Facial Trauma courses in 2024. Thank you.
Dr. Susarla, thank you so much for hosting this case study review, and I enjoyed learning from you as well. I hope to see you all at MFT courses in the future and to the small group discussions, and thank you to AO as well.